So I guess we'll begin. So today we're doing a webinar on finding reliable health information online, what you need to know. And I'm going to talk a little bit about the Healthy Libraries program. So we're a partnership with the Public Libraries of Suffolk County, the Suffolk Cooperative Library Systems Outreach Services Department, and we are supported in part by the American Heart Association of Long Island. We're an interdisciplinary team of public health, nursing, and social work students. And our aim is to provide evidence-based health information, screening and case management to a diverse community of patrons in the public library setting. We also refer patrons to promote access to appropriate health and social service programs locally that will address their health and social support needs. And we want our students to experience an interprofessional team and demonstrate the core competencies based on the Interprofessional Education Collaborative. So these are some of our student leaders and faculty leaders who helped work on this presentation. And I'm going to pass it along to Jessica Coos, who's going to introduce herself. She is the faculty supervisor who helped us create this program.
Hi everybody, I'm Jessica Coos. I'm a health sciences librarian at Stony Brook University, where I'm the liaison to the School of Medicine, the program in public health and biomedical informatics. And I'm very excited to have my interns, Mev, Esther, and Jonathan present this wonderful webinar today on health literacy. So without further ado, I'm going to turn it over to them and get started. Thank you.
I'll start. My name is Mev Gallagher. I'm in my first year at the Graduate School of Library and Information Studies at Queens College, CUNY. I have a background in comparative literature and French from UC Davis, and my professional background includes working in health journalism.
Hi everybody, my name is Esther Lee. I recently completed my Master's in Library Science at Queens College as well, and I previously hold a Master's in Public Health from Columbia's Mailman School of Public Health.
My name is Jonathan Perez. This is my second year at Queens College. I'm currently in the dual degree program for library science and history at Queens College.
All right, so now I'm going to ask everyone to just put themselves on mute. If you have a question throughout the presentation, please type the question into the chat and we will work to answer your question at the end of the presentation. We'll also have about 15 minutes or so at the end of the presentation where you can ask any questions you have. So during that portion, you can unmute yourself and ask those questions. So now I'm just going to launch a, pre-webinar poll. Go through the learning objectives. So the objectives of, by the end of today's webinar, you will learn how to identify the definition of health literacy, identify positive outcomes associated with having health literacy as a skill set, identify characteristics of a reputable sources of health information, identify the elements of the CRAP test, and identify the benefits of open access journals, as well as identifying reputable sources of reliable health news. So now I'm going to pass it over to Esther, and she's going to talk about what health literacy is.
Hi guys, so I'm going to talk to you guys about the definition of health literacy. According to the CDC, the Center for Disease Control and Prevention, they define it as the ability to find, understand, and use information to inform health-related decisions and actions. And it goes further than just the readability of a text or if it's written in plain language, as it shows on the little diagram above. It basically empowers you to make the most informed decision that you can make about your health. Next slide, please. So why is health literacy so important? First of all, it can help us prevent health problems and protect our own health. It can also differentiate between reliable health information and false information. Also, research says that 9 out of 10 adults struggle to understand and use health information when it is unfamiliar, complex, or jargon-filled. And lastly, limited health literacy costs the healthcare system money and results in poor health outcomes. Next slide, please. So health literacy is especially important now with the COVID-19 pandemic. One of the reasons is that we get an overload of complex and contradictory information about COVID-19, and some of us are having trouble accessing trusted information. Also, the combination of social media allows for fast and widespread of information. Sometimes it's not vetted, and that can ultimately lead to confusion, misinformation, and higher risk of COVID infection, resulting in poor health. Next slide, please.
Okay, that's me. So here you see a headline from the New York Times. It says, oh, it's the previous slide, please, Gabriella. Thank you. So the burning cell towers out of baseless fear, they spread the virus. This is from a story published in April of this year about a conspiracy that 5G technology is linked to the cause of the coronavirus. Researching this story, Times reporters found 487 Facebook communities, 84 Instagram accounts, and 52 Twitter accounts encouraging this conspiracy theory. And in March, the top 10 YouTube videos about it had 5.8 million views. In England, some people took it to such an extreme that they set cell phone towers across the country on fire. So this is a prime example of how quickly and easily fake news can spread and how dangerous it can actually become when people believe it. So next slide, please. Great. So a recent study by the Cornell Alliance for Science on the spread of COVID-19 conspiracy theories online found that of the top 11 fake news topics being passed around between January and May of 2020, the most popular stories by far were about miracle cures. We don't know enough about the disease, so we're all looking for answers. The problem is that science doesn't have all the answers yet, and not enough people know the right places to look. This chart on the right that was also made by the scientists who did this study shows how frequently each of the top 11 COVID misinformation topics appeared in both mainstream and social media between January 1st and May 26th of this year. As you can see, the most popular topic by far is miracle cures, with nearly 300,000 appearances. I think it shows that people are kind of starving for good health news. The next most popular topic is the conspiracy theory that COVID is related to the New World Order / deep state, but that one has a comparatively low 49,000 mentions. The rest of the topics are even less popular: that COVID is a Democratic Party hoax, that it's a bioweapon developed in a lab in Wuhan, China, that it's Bill Gates' fault or due to 5G technology, like we talked about earlier. And then the chart gets into the uglier stuff: anti-Semitic conspiracies, that COVID is a poor form of population control, that Dr. Anthony Fauci of the National Institute of Allergies and Infectious Diseases has something to do with it, that whole pandemic thing, which I think is related to the population control conspiracy. And finally, with just over 6,000 mentions, that COVID was caused by bat soup. I think what's important here is that what people are most often looking for is health news, and they're not getting real health news, and they might not know how to get it. So instead, they're looking for miracle cures, which just absolutely don't exist. Next slide, please. Thank you. So it's about spotting fake news. We all make mistakes. Before you believe or accidentally pass on bad information, it's important to take a moment to double check what you're reading and have the facts. Judging whether information is true or false is a central task in a world where information is more accessible than ever before. This is like what Esther said about sort of an information overload. You know, it means it can be hard to pan for the gold of real news amid all the sand and rocks of information, whether it's good or bad. The graphic to the left of the slide comes from the IFLA, the International Federation of Library Associations and Institutions, and it is based on factcheck.org's 2016 article, How to Spot Fake News. On the IFLA site, they have the graphic translated into over 40 languages if you want to repost it yourself in your communities. I want to go through the tips, but I don't want to go into too much detail since Esther's going to cover them in our next section much more, in more detail. So first in the infographic, we have consider the source, then read beyond, check the author, and look for supporting sources. Check the date. You got to make sure it's not some random story from like 1998 that has no bearing on today's health news. Is it a joke? It might just be too ridiculous to be believed. Then we come to check your biases. On this point, I want to be honest about my own biases. For example, like I cannot tell you how many times I have read a story about people like buying crystals and thought to myself, do I need to buy healing crystals? Like, I don't. But I have read nearly every silly, like unsubstantiated story about how someone bought an amethyst and then their hair grew 3 inches and their cat started being nicer to them. Like, I know the benefits of crystals are not scientifically proven, but still I've got this bias about them. So biases are real and they can really affect your judgment. Finally, on the infographic is ask the experts. You can ask a librarian like us at HELP or at your own library. You can consult a fact-checking site like, say, factcheck.org. Next slide, please. All right, so here are just a few tips about keeping fake news out of your feed, which, you know, can be really hard because even if after you've sat through this webinar and learned everything you need to know about where to find correct, helpful health information, you're likely still going to have people in your life who don't know, and they're probably going to post stories about miracle cures. And what are you going to do about that? Well, you can point them to the recording of this webinar that'll go up on our YouTube later this week. You can also take some expert advice. These tips come from an article by David Shaw, who is affiliated with the Care and Public Health Research Institute at Maastricht University and the Institute for Biomedical Ethics at the University of Basel. And he says he wrote this article after his wife started getting a bunch of fake health news stories sent to her by people she knew and trusted. So to the tips. First, don't believe something because someone you know and trust told you. And definitely don't share information you haven't verified for yourself. Do check out the source of the story. Is it from a reputable publication? Does it cite facts or rely on claims like my friend heard? Because we've all got a friend who's heard something. Do look it up, but don't just Google it. Look up a key phrase on a reliable website like the CDC. If it's about COVID-19 specifically, you can check out FEMA's coronavirus rumor control page. That is linked there in the document. Don't just ignore it. If you find out it's fake, tell the person who shared the story with you politely and show them what you found. If you're on a social networking site like Facebook, you could post a link to true, helpful information or an article debunking the false one. And do be kind. It can be embarrassing to learn you've accidentally spread fake health news. And remember, some people still may not believe you. The repetition effect means even the truth can sound fake if someone hears a fake story enough. It's like me and the crystals. That's why I stopped reading articles about how great they are. Finally, do share these tips with your family and friends, and do your best to keep fake news out of your networks. So now I'll hand it back over to Esther. Next slide for Esther, please.
So we're going to give you some tips on how to become better at finding reliable health information. And the first tip is to, like Mev mentioned, check the sources. Next slide, please. If you look at the picture on the left side of the screen, we would recommend doing 3 checks that you should do for every source that you encounter. First, a visual check. Look at the background and site layout. Is it well made? Are there ads from products that you recognize? Does the title use capitals? Avoid headlines that provoke strong emotions. The next check you can do is a site check. Check the web address. Be careful of the URLs that are similar to popular news sources. Also check the About Us section on a website. Also to keep in mind is who wrote the information and is it biased? Lastly, you should do a fact check. Are the sources covering the story? If not, then it's most likely not accurate. Read the reputable and multiple sources. Are there links in the article to other sources supporting it? Some other questions that you can ask yourself is, where is it posted? Look at the ending of the URL. Is it a .com website? Are they trying to sell you something? Also, who is the sponsor and do they have a particular bias? Next slide, please. Tip number 2 is to check the supporting sources. Next slide. So some of the questions to ask for this tip is, are there supporting sources listed to back up the claims made? Are the supporting sources reputable? Also, an important one is to check if the hyperlinks included in the supporting story actually working. Next slide. Lastly, the tip would be to check the author. Next slide, please. Nowadays, it's so easy to post information on the web, no matter what your expertise is. So there's a lot of false experts. So we have to be wary of them. False experts are often used to manipulate information for their own agenda, and their role is to add credibility to a message, no matter how unfounded it may be. So how do we debunk them? You can go online and check who that expert is. Is she or he really an expert in this area? And who does she or he represent? And some of the additional questions to ask yourself is the author credible? Do they have a degree in the same field in which they're writing about? Also, are they a real person? And lastly, are there any conflicts of interests? Next slide.
Now we will be discussing some online sources to help with evaluating information. We're just going to go through some websites and some strategies. Next slide, please. So this website is called Trust It or Trash It. This website gives 3 steps to properly evaluate information. The first step that they give is who wrote it. It is important to make sure that a credible person from a credible institution wrote the article. Essentially, check the name and the credentials of the person who wrote it. The second step, when was the information said? Check if the information is correct, is current, that it's up to date. Avoid outdated information without a date. And 3, how did they know? It is important to make sure the information is backed up by research and not opinions. Another tip is to compare it with other sources. One source by itself can be too good to be true. Next slide, please. The next one's called the CRAAP test, C-R-A-A-P. C stands for currency. Is the information up to date? Make sure that the information is as current as possible. Also, if you're online, make sure that any links work in the article. R stands for relevance. Is this information right for you? What audience is the author? What audience is the author addressing, and is it appropriate for that audience? As a person seeking healthcare, do you feel comfortable with this information? Authority. A stands for authority. Is the author reliable and qualified to write this information? Can you contact the author for more information? The URL can point you in the right direction. For example, .gov and .edu tend to be reliable sources of information. Those two are two you can generally rely on. Any college websites, .gov. A stands for accuracy. Does the information come from reliable sources? Is there evidence? Check to see information was peer-reviewed. Look for objective and grammatically correct information. And last but not least, P stands for purpose. Make sure the author is trying to teach information as opposed to selling something. Is the intentions of the author clear? Do they state what their intentions are? Make sure the information is objective and free of any type of biases, whether be it religious, political, etc. Next slide, please. And the third thing is the DoAJ, the Directory of Open Access Journals. Typically, peer-reviewed journals descriptions cost a lot of money and therefore are not accessible to the individual. Colleges spend a lot of money to get their journals. In order to disseminate free, high-quality articles, the open access movement was created. The open access movement provides free peer-reviewed journals spanning numerous topics to anyone with an internet connection. For any questions regarding health literacy, DoAJ is a great choice for quality information that is free. Don't be afraid to use DoAJ for any other topics of interests. A couple of benefits, as can be seen in the graphic, for open access journals is one, accelerate discovery. With open access, researchers can read and build on the findings of others without restrictions. Public enrichment. Much scientific and medical research is paid for with public funds. Open access allows taxpayers to see the results of their investments and improves education. Open access means that teachers and their students have access to the latest research findings throughout the world. Next slide, please. So just a couple of qualifications, helpful information to know is, what does peer-reviewed mean? So a peer-reviewed article means that it was looked over and reviewed by other experts in the field. Essentially, it was looked over multiple times to ensure its quality. And important information regarding DoAJ, it's important to not just assume that open access articles are reliable. It could still be fake. Therefore, make sure to look over it using the CRAP test or trust it or trash it. These are just two qualifying information to know when dealing with the DoAJ journals. Next slide, please.
Great. That would be me again. Hello. And now I am going to tell you about some places where you can get your health questions answered. Next slide, please. Right, so here's some good health sources for good health news. You can visit government websites. Remember, their URLs always end in .gov. There's the CDC, which is the Centers for Disease Control and Prevention. The FDA, the Food and Drug Administration. There's Medline Plus, which is a site created by the U.S. National Laboratory of Medicine that you can use to find information on health and wellness, drugs and supplements, genetics and medical tests. It also has a medical encyclopedia and healthy recipes, and it's written for us lay people in mind, so it's easier to understand than the language used in formal studies. Definitely check it out when we're done with this presentation. Next slide, please. Yes, some good sources for real useful COVID news, since it's on all of our minds. The AARP has a fraud resource center with articles and short videos on health and other scams related to COVID. They're aimed at senior citizens, obviously, but they can be useful for people under 65 as well. The government has set up coronavirus.gov, so you can get up-to-date COVID news that's been scientifically vetted. As I said earlier, FEMA, the Federal Emergency Management Agency, has a coronavirus rumor control page that can be helpful in clearing up fake news you might hear. The FTC, the Federal Trade Commission, has also set up a coronavirus scam site with consumer advice. Hint, colloidal silver will not cure anything, so if someone is trying to sell it to you, say no. And finally, Johns Hopkins has a daily updated virus spread tracker that you can use to see how prevalent the virus is anywhere in the world. You can search by state and county. So I was able to search and see that as of Saturday, October 10th, when I was looking, Suffolk County had a little over 47 confirmed cases, for example. It can be sobering to look at, but it is a useful tool to keep up on current COVID information. Next slide, please. Great, you can also get your health news and information more locally. Talk to your healthcare provider. That's their entire job, to care for your health. If you can't get in to see them, or it's not safe for you to go visit them, lots of doctors are offering different types of telehealth visits now. So check that out. You can look on your doctor's webpage if they have one, or call their office and find out. You may not have to go into their practice to get your health questions answered. Second, librarians. Library.com is Suffolk County Cooperative Library Systems Virtual Reference Desk. So check that out. They have lots of different databases and other resources that you can use. You can also chat with your local librarian. Lots of libraries now, they offer chat or email or phone reference services. Depends on what they've got set up, so you should definitely check your local library. Like here in Brooklyn, where I live, I actually had a really great time chatting with a reference librarian at the Brooklyn Public Library's virtual reference desk a few weeks ago. It might seem weird to talk to a librarian without actually talking to a librarian, but it definitely works, and librarians know how to find good answers for you. It's literally their job. And then there's always us at the Healthy Libraries Program. We have a website, and you can contact us via, whoopsie, sorry, kitten. You can contact us via phone or email. You can also like us on Facebook to get a heads up on more health education webinars we're doing, and catch up on the ones you might have missed on our YouTube page. I'm going to drop that info in the chat for everyone now while I turn the presentation back over to Gabriella for the final poll.
All right, so now we'll move on to the question and answer portion of the presentation. Does anyone have any questions? I know that Susan had messaged me in the chat saying that she wanted to talk more about bias and finding reliable health information. Maybe Jessica, you could talk more about bias. Or does one of the students want to discuss more about bias when reading health articles?
Sure. I think I covered it a little. So I guess I would say that bias would be like on your side, whether you, and like your beliefs sort of predispose you to believe something because, you know, you maybe you've heard it in other places, or there's just something about it that kind of like strikes you as being believable. As far as bias, on the other side, I mean, you know, the journalists are meant to be objective, but I think every single person, because they have biases, like there's no way to have perfect objectivity. And if you read certain articles, it could be plain to see that the writer is really trying to get like a certain point or opinion across, rather than offering like balanced facts, or saying, you know, this, you know, trying to talk to people from different sides of a question. So I hope that answers the question about bias. It can come from like internally, and it can come from the source itself. The person can just be writing from a certain point of view, trying to get you to believe a certain thing.
Right, and also when you're looking at something, as Mev mentioned earlier, you want to keep in mind your own biases. Are you really having an open mind? Are you really looking carefully for all the clues that Esther mentioned earlier in the presentation? So those are very important things to keep in mind, is to keep your own bias in check.
If I could just add on to that, I think it's important. That's why it's important to consult multiple sources and multiple articles, not just look at one or two, and to make sure you're getting a very thorough overview of the topic, or if there's a resounding consensus among different experts. Yeah.
Do we have any other questions?
I noticed we had a question in the chat about WebMD and whether or not that's a reliable source. So that's a great question, and I love it when people ask me that. So WebMD isn't inaccurate in itself, but guess who funds WebMD? The drug companies. So it's fine if you want to use WebMD for just basic medical questions, but you really have to be careful and consider, what are the interests of the pharmaceutical companies? What are they going to tell you? They might actually try to influence you, shockingly, to use their products. So again, that's a .com site, and you want to just be especially vigilant when looking at that for medical information. And of course, you know, any sort of medical question that you have, if it's significant and applies to your health and well-being, I would recommend asking your healthcare provider for more information. But that was a great question. Thank you.
So Susan in the chat also said more about the directory of open access journals and how to access that. Jessica, one of the students, do you want to talk about that?
Sure. Yeah. So for my purposes, I use DoAJ a lot when I happen to come across an article or a journal. And basically, you can type in the name of a journal, and if it's in the directory, you can feel pretty confident that it's a reliable source. However, if you can't find the journal listed, then you need to be vigilant and a little bit concerned. It could be possible that it's a legitimate journal, but it also may be what's called a predatory journal. So if you see something that's not appearing in DoAJ, I recommend that you use some of the tips we talked about earlier in the presentation to try to identify whether or not the journal is reliable or not. And I'm sorry, my voice is going. I have killer allergies this time of year, so please bear with me. Did that answer your question about DoAJ?
I think she wants to know where she can access it.
Yeah, the link is doaj.org. So I could put that in the chat for you. And I go ahead, Gabriella, sorry.
Reminder, the DoAJ open access journals those are more like, if you're searching for health related information in there, those are scientific journals. So they are for, you know, other scientific researchers. So the terminology that may be used in those journals might be more advanced. And you should also use the CRAP test, as Jonathan mentioned, because they aren't necessarily peer reviewed. So you also want to make sure that those are reliable sources of information.
We also have another interesting question in the chat from Longwood. Is there a site where you can find doctors are invested in certain pharmaceutical companies? That's a great question. That information is not so easy to find. I would have to look into that a little bit more. If you wanted to send me an email, I could put my email address into the chat box and I can help look into that for you. If the doctor is an author, they should be disclosing if they're working with a pharmaceutical company as a conflict of interest. So you could, if the doctor is published, you could look up their publications and check for that. But honestly, I don't think that there's a comprehensive listing or listings of which doctors are working with different pharmaceutical companies. Good question though. Obviously, a doctor from a certain pharmaceutical company would be possibly more likely to prescribe something from that company. So that's a big issue in healthcare. Great question.
Thank you.
You're welcome.
I also did a little bit of research in the meantime, and there is this website called openpaymentsdata.cms.gov, and you can search by name people to see if there's been payments by drug and medical device companies to physicians and teaching hospitals. The data is only from 2013 to 2019, so it might not be current or up to date, but it might be a site that you could use to find that information. I would just have to look more into the website, but it looks like it's a federal government website managed by the Centers for Medicare and Medicaid Services. So it might be a good site to look into this.
Gabriella, can you please put that link in the chat?
Yes, I'll type it out. I looked it up on my phone because I'm sharing my screen.
Oh, okay. Thank you. Good question.
That should be the link, openpaymentsdata.cms.gov. If you copy and paste that into your search bar, it should work.
Can I ask another question? This is Jill from Longwood.
Sure.
Okay, I was just asking that question because as people, the vaccines will be coming out hopefully in the next 6 months to a year. And part of me is, you get a little, what the word is, I guess questioning if somebody pushes a certain vaccine, is that because they're, they have money invested, such as, I'm not getting political or anything, but the president was pushing what was the name of the drug he was given while he was in the hospital? And it turns out he's on, he has a big investment in that drug, the monoclonal antibody. So
Regeneron, I think. Regeneron?
Yeah.
Okay.
So that was my concern when somebody's pushing something. Do they have a financial, they have a financial stake in it? So I want to, to be able to tell my patrons where to look for that information. So I will check the openpaymentsdata.cms.gov.
Yeah, that's only up. It says they only have data up till December 2019. So it might not be the most current information. We'd have to look to see if there's some other website that is more current.
Okay. I guess we can also, like when there's the different vaccines, Eli Lilly and Johnson & Johnson, I'm assuming you can look on to see who they're, who's on the board and who's putting money into them, for the different vaccines.
There should be able to be a way to find out that information by searching. It might be available on their websites and things like that.
Like who their investors are. Okay, thank you.
Just in my experience, writing about like health and medications, it can just be really tricky because you genuinely can get good research that is sponsored by drug companies. So I certainly wouldn't say that you shouldn't look this information up, because it certainly is important to know like who is sponsoring whom, and you know, who has interest in what vaccines say. But also, like, there is a lot of private funding that goes into medical research. So sometimes it can be unavoidable that a doctor will, or a researcher will have taken money from a certain company to do research that is related to drugs that company might be producing. It's just, yeah, it can be just sort of a gray area, but certainly the site looks really interesting, and you should always, as we say, do your research.
So we have another question in the chat. Just because Mev felt inclined to believe in crystals, does that really qualify as a bias? She says so, but I disagree. Mev, do you want to address that?
Sure. I mean, I guess it depends on your definition of bias. I mean, another example may be that you are biased to believe, I don't know. I'm sorry. It's a little hard for me to riff on this. Like say I'm biased because I work with I don't know, trapping and returning cats. So there's studies that say that that's bad for the environment, and there's studies that say that that's good for the environment. And because I'm involved in it, I'm biased to believe the studies that say it's good for the environment and the ones that say that TNR is bad and it hurts birds. I reject, like, a sort of before I even read the study. I guess that might qualify as a bias. Maybe that helps explain it a little better. If it doesn't, please let me know. I can try again.
I think also what Neve is trying to point out is that she may believe that crystals, have some sort of, maybe properties, but it's not scientifically proven that they do that. But if you believing in them, if that helps you and it, doesn't hurt you, then it's fine to, think about crystals or purchase them because you like them. But when considering like more health information, you want to be wary about, considering all of the facts and making sure that you have found all of the evidence on a certain topic.
Fran has a great example. I'm sorry, I didn't mean to interrupt. Fran has a great example about biases that she put in the chat about vaccinations. So we know there's anti-vaxxers out there, people who believe that vaccines are dangerous and damaging. So if somebody has a really strong belief that vaccines are in fact harmful, and you present them with, I don't know how much research that vaccines are beneficial to certain people or to a large number of people, the person already has the bias that vaccines are bad. So they're not even going to consider the research. They're probably not even going to really look at the research and analyze it and try to assess whether or not it's true. They're just automatically going to reject it. So I think that's where we have to really be careful of our own biases. Are we rejecting something, whether or not we're aware of it, or it's more on a subconscious level? And we need to look past that to really evaluate the information using the facts that are in front of us.
Any other questions? We're just coming up on 3 o'clock, so we should probably wrap it up soon. But if anyone else has any other questions before we end, please either unmute yourself or you can write it in the chat now. All right, well, thank you everyone for joining. And again, thanks to the students and the faculty supervisors for creating this presentation. And also we want to thank the public libraries for hosting us and allowing, promoting us on their websites and to their library patrons. So again, the webinar will be available on our YouTube site, and the libraries will also get the recordings to post how they decide. And yeah, thank you everyone for joining.